I'm Kirsten and I'm the CoolSculpting Specialist here at Renaissance Plastic Surgery in our medical spa. And welcome to our live CoolSculpting virtual event. Be sure to stick around till the end of the event where we'll be doing a live Q&A and you can submit your questions in the questions tab below. Our specials tonight are with any CoolSculpting package you purchase, you will receive a CoolTone package for free, plus a free Skinmedica Firm Tone. And then our big giveaway for tonight is one lucky winner is going to receive a free Diamond Glow facial.
CoolSculpting's been around for over 10 years now, and I've personally even seen with having it in our practice for over 6 years that they're constantly evolving. The science is always there, it's always the same, but they're always trying to figure out how to be better. And I think that's one thing that makes CoolSculpting unique compared to other body contouring devices out there on the market. I don't think anything else compares, to be honest. We've tried other modalities in our practice and we just noticed that patients weren't as satisfied as they are with CoolSculpting. And here at Renaissance, we are able to offer you the most latest and greatest technology that CoolSculpting has to offer with the CoolSculpting Elite. And we're really excited. So CoolSculpting is the #1 non-surgical body contouring device out on the market. And it uses a unique technology called cryolipolysis. Cryo meaning cold or freezing, and then lipolysis is the killing of the fat cells. So it basically freezes the fat cells during the treatment, and then about 2 to 3 days later, the fat cells will start dying off one by one, and they'll continue to do so over the course of the next 3 to 3.5 months. And then your body just naturally will process them out through your lymphatic system. So an ideal candidate for CoolSculpting will be somebody who works out here and there or every day. They eat fairly healthy. They're somewhat within their ideal goal weight, but they just, no matter what they do, they still can't seem to get rid of these stubborn areas of fat. And no matter how much they work out or, you know, how many pounds they can drop on the scale, they still have these stubborn areas that they know are going to always bother them. And that's where CoolSculpting can come into play. So CoolSculpting is FDA cleared to treat numerous areas of the body, starting with the submental area or the chin. We can treat the arms, we can treat bra fat, we can treat the back, lower flank, love handle area. We can also treat the inner and outer thighs, as well as the knees. So what we have found that works best with our practice is our patients doing at least 2 sessions of CoolSculpting. So that meaning they come in for their first session and, you know, they may do multiple areas that same day. However, about 6 weeks or so later, they'll come back in and do their next session. And usually that's what most people find really gives them that wow factor where they're really happy with their results. But, you know, every now and again, someone may want a third treatment or even to treat another area. So we've obviously established that CoolSculpting is non-surgical and no downtime. So with that being said, you can get the treatment done, you can leave here and do whatever you wish. However, there's going to be some little minor side effects to keep in mind when getting your treatment done. The most common ones would be swelling in the area that we treated or even numbness. And that can typically last anywhere from a couple days to sometimes a few weeks. It really depends on what area we treated, how many areas, and how many applicators we applied to that area. The other side effects that can happen are bruising. So if you're someone who typically bruises no matter what, you know, you may have a little bruise here or there. So with that being said, I usually tell people if you have a big event coming up or you plan to be at the beach in a week or two, you know, just keep that in mind when booking your appointment and scheduling your treatment. So CoolTone is the latest innovative technology to tighten, tone, and strengthen your muscles. It's a great way to target the muscles that you can't always reach when you're exercising in the gym. It's FDA cleared to treat your abdomen, your thighs, and also the buttock region. And we brought it into our practice in addition to CoolSculpting to really help kind of enhance your CoolSculpting results. So say, you know, you get CoolSculpting to your abdomen, you get rid of that like top layer of fluff, as we like to call it. After, you know, you get rid of that, you can go in with the CoolTone and kind of tighten and tone your, you know, your abdomen muscles and make it look really nice for the summer.
So go ahead and show me what bothers you the most.
I'd say like right here.
Okay. I'm going to mark out the line of your abdomen here, just so I know what we're working with. Then I'm going to feel around, okay?
Thank you for attending our virtual CoolEvent. The giveaway winner will be announced via email, and if you'd like to schedule a complimentary consultation, you can do so through the text. And be sure to stick around after for a live Q&A with me.
Oh, there we are.
All right, we are live.
Hi.
Thank you guys for tuning in and joining us on this Tuesday evening. Me and Dr. Boschert. So before we get into all the questions, I just wanted to remind you guys about the giveaways and the specials that we are offering tonight. So one lucky winner will be notified via email or text or call, and they will be winning a free Diamond Glow facial. So the Diamond Glow facial, here's a little brochure on it. But it's a 3-in-1 facial. It's a great summertime facial that's going to exfoliate the skin, extracts and infuses serum into the skin. So one of you guys will be winning that tonight, which is very exciting. And then for our specials that we'll be doing, the first special is with any CoolSculpting package that you purchase, you'll receive a CoolTone package for free. And then with any CoolSculpting package that you purchase, you'll also receive a free Skin Medica Fermentone. So it's a great body serum just to kind of help with the little crepiness that you can get here and there. So it's great for the arms, the knees. You can put it on your abdomen or anywhere that you do your CoolSculpting just to kind of enhance the results as well. And so, yeah, I guess let's get started.
So Fermentone, they can use that too. Like, you know, like a lot of times we're doing the CoolSculpting on the back of the arms.
Yeah.
But you get that little bit of crepiness on the front, like, you know, on that side. And I think that's a nice adjunct to the firm
Yeah.
to help with that little bit of crepiness of the skin.
I agree. I think it's great too, like right in here where you're kind of bending a lot, or like the knees.
Yeah.
Knees is a good one too.
Right.
But yeah, absolutely.
So,
all right. Let's get into the questions that you guys have submitted.
so I'll do that first.
Okay.
So the first, somebody asked a question about, the CoolSculpting is really 2 treatments, right? So about 4 to 6 weeks apart. So somebody asked, CoolSculpting advertises a one-time treatment, which is possible. I think that there's a few things that go into that. Look, the quality of the skin in the area itself, because some areas really respond rapidly to it. That softness of the fat. The older we get, the softer the fat is, and like medial thighs and sometimes arms respond really, really quickly. And so I think that Kirsten looks at the area and, if you do the one treatment and you come in 6 weeks and we're like, that looks fantastic, then I would say wait another 6 weeks and see what you think. You don't necessarily have to do 2. And I think that's what CoolSculpting is really getting away with, or what they're advertising. So I think it's a reasonable option, and we look at it for everybody.
Yeah, absolutely. All right. Someone said that they just want to know how CoolSculpting works, so they've tuned in. So great. Glad you guys tuned in and watched. I see a lot of cost questions. So obviously cost is a hard one to give. It's not the same cost for everybody. We definitely can give you an exact price when you come in for your consultation, but just to give you guys an idea, like say if you wanted to treat your arms, and that would be including 2 sessions to the arms, it's typically around $2,400. So if that kind of helps. Abdomen can start around $2,400, but it can also go up from there just because it's can be a wider range area. All right. Is there any pain during the treatment? So, everyone responds differently, I will say. When we attach the applicator to you, so it's like a little suction, and that doesn't hurt at all. And then you start the coolant, and I always say that you feel that cold kick in pretty immediately. And it gets very cold, almost to a point where it kind of feels like a slight burning sensation. And that can last anywhere from, a couple minutes, 5 minutes or so. And that can be a little uncomfortable, but then it goes numb. And so usually people are sitting there reading, watching a movie. Some people seriously nap. People don't believe me, but they do. And then it's fine. But when we take it off, all that blood flow is kind of rushing back to that area, which we want. And so sometimes that can be a little uncomfortable, but again, it only lasts for a few minutes. And by the time you leave here, you're fine. So yeah,
I think if you're online too,
you've had it done, so you can explain too.
So I agree. And I'm a total wuss, but it wasn't that bad. So this is a CoolSculpting Elite, which is the newer generation of CoolSculpting. And honestly, I don't think it hurts as much. I think we're on like the 3rd generation.
We are.
So the first one, it took like 45 minutes. And I had one treatment with that on my love handles. And yeah, it kind of, when you took it off, it was burning and it was really cold. And then the next generation, they changed the applicators. Yeah. And we went from 45 minutes to like 35 minutes.
Yes.
And
time went down.
And then I did that one. I did the second stage with that one. And I think it worked great. And it really isn't that bad. You put it on, it's cold at first, and then it kind of goes numb. And just, you sit there for about a half hour, 35 minutes, and you're like, okay, you take it off and then massage it, which kind of tickles. And then
some people seriously
probably the worst part is the tickling part of it. And then after that, it just kind of warms up and it feels like you had a sunburn in the area for a little bit. But it's really it's not that bad.
And then afterwards too, like he said, we've had 3 different models and generations of CoolSculpting in our practice, but the suction used to be way more intense. When I say it would like pull and draw on your tissue this much. So in result, you did have a lot of swelling. And I feel like that has gone down at least like 70% than what it used to be. So they've definitely come a long way.
So there's not as much swelling afterwards, but really after CoolSculpting, you don't have to wear any kind of compression garments or anything. So like after liposuction, when we do it, it's great because it's all done at one time. But the downside is you're wearing a garment for about a month. Whereas you do CoolSculpting with Kirsten and you have it done, you go home and it looks red or bruised a little bit for that first week, and then
no downtime though.
Fades away. It's really not that bad. And then you just kind of watch the results happen.
Awesome. All right, let's keep going. We had another one about cost, which I feel like we answered that. Is it charged are you charged by time or areas treated? So we do not charge you by time, but it is, so it, yeah. And technically, yeah, you're charged by the areas that we're treating. So basically the amount of applicators that we apply to your body, which if just to give you guys a reference, I brought some in here. Like this would be one we use on like the back or the abdomen, but the amount of these that we put on your body is how cost is determined. So, which again, when you come in for your consult, we'll actually bring these out just to kind of see how many we're going to apply to the area. And that's where we, again, come up with the pricing on that. So
yeah, and Allergan, who has this company, we have a special card that we have to put in the machine.
Yeah.
And they allot for everyone. You put it in, it starts. That's how much the card costs. That's how much the treatment costs.
Yep. All right. I've been in the past and want more treatments. Do I still qualify for the buy one, get one? Absolutely. So we can get you set up for a consult, and I can give you a call too, and we'll make sure we get you that special.
And even if you use the old machine, because we've had Elite for over a year.
Yeah. I think she's used the new one too. So
okay.
Yeah, she likes it, so she wants more.
I know that feeling.
You mentioned that clients can have multiple areas completed at the same time. Is this in the same area of the body, like inner thighs and maybe knees, or bra fat and underarms? So with the machine, we have basically two hoses. It's like a little octopus. And we can, in reality, we could treat one arm and then one knee. And it's 35 minutes. And then we switch and can do the opposite sides, which does come in handy because with like abdomen, you can't overlap those areas. So if we're doing an abdomen and the arms, we're able to do half the abdomen plus the arms, rotate, and just make the most of your time and our time together. So that way we get you out of here faster than all day. So let's see. Does CoolSculpting need any maintenance, like years down the road? I have always said, I mean, CoolSculpting is, I guess, would you say like lipo? Like once you get rid of the fat cells, they are gone for good.
Yep.
My biggest thing is, I always tell you guys too in the consult, is as long as you maintain where you're at when you get CoolSculpting, you should be fine. You know, you still have fat cells in that area though. So if you do go and put on 10, 15, 20 pounds, you may enlarge some that are still in the abdomen where you got treated, or you may notice they go elsewhere. And then you'll be coming in later because you're like, now I have bra fat that I never had before. So if you gain weight, it's going to go somewhere, but those fat cells that we got rid of and that were destroyed are not going to come back.
Right.
So.
And then, the thing is that after puberty, humans don't make any more fat cells. And so if you have 1 million fat cells right here and you get rid of them, you go down to, 500,000 or whatever.
Mm-hmm.
You now have half the potential for that space. So you gain 50 pounds, that space, the potential in that area will never be what it could have been. But then, like she said, if you do that, you may end up, with fat ankles or
something.
Right,
it's going to go somewhere.
something else.
But I always want to explain to, like, people are like, am I going to look super unproportionate then if I gain weight? I'm like, it's not going to be that noticeable, but you will find it. That's for sure.
It just goes to a different area that you would have normally gotten. We're genetically predisposed to put our fat in a priority position in us. And it's sort of genetically like where you store most of the brown fat or the long-term fat. And if you get rid of that area, well, now your body's just going to put it in another spot that would have naturally come that way. So you're not really going to end up with lumpy eyebrows and ears.
Yeah.
It doesn't go crazy like that.
Oh my gosh, that's funny. Okay, let's see. So we did that. Does this treatment work well with loose skin? So it's definitely not a device it's not a skin tightening device by any means. I would say it depends on what your skin quality is when you come in for that consult again, which we would evaluate at that point. If it's just skin though, CoolSculpting is not going to freeze and remove the skin. It's there to destroy and get rid of the fat cells. Now, if you have a little bit of laxity in the area, we always talk about that in the consult that, depending on the area and your age and the skin quality that's already there, it could possibly tighten up a little. It could get worse. It could stay the same. It's hard to say. But we definitely would talk about that when you come in.
So same kind of question. It's asking about, somebody is asking about
Happens to your
skin
skin afterwards.
quality and what happens to it. So we normally, if you gain 50 pounds and you're 20 and you gain 50 pounds and you shrink down, typically the skin is such good quality that I always say it like shrink wraps really nicely, and you can really shrink wrap well. If you're 75 and you do this, your shrink wrap ability is like so diminished that you already know you have loose and lax skin. And we do it, you may get a little contraction, but not to the degree that you would have got when you were 25 or 30. So, and we all know as the skin quality decreases with time, your ability to shrink wrap decreases with time. I do think that, like, especially even see like in medial thighs, which is such thin skin and people get crepey skin there so easy. But if you do shrink, it does snap back pretty good.
And I think arms do a fairly nice job as well with CoolSculpting. You know, a lot of us women will start to get the, what do you call it, the bingo arm or whatever it is, but you start to kind of notice that slope. And I do feel like it does a nice job with like kind of just tightening and giving you a more straight and narrow.
And that's the other thing that Kirsten's going to do, and all of them, is that you look at the quality of the skin, and if you're at that point where you're getting that little bit, then we do have other stuff that we can look at, whether it's halo. We do a lot of lasers on the face, even off the body, even around knees and elbows. And then the Fermentone is another great product that you can help. And so we're going to look at it as a package and look at the whole adjunct. Is there something else we could do to make the experience better?
And we have CoolTone.
Yeah, and CoolTone. Well, that I don't think CoolTone's going to do anything for the skin.
No, not the skin, but it'll help firm and tone those areas.
It'll firm and tone.
Yeah.
So use the cream for the skin, and you use the CoolTone down deep, and it really tightens the musculature. And then since you've gotten rid of the fat, then you can really sort of look at the anatomy, and that's what we're looking for in a beautiful abdomen or arm.
All right. So we answered those. Do you have to make an appointment today? I have a scheduled appointment in August. So no, you don't have to make an appointment today. We'll actually be, towards the end of this, you should receive a text. And if you are interested in scheduling a consult, you'll actually respond with, I believe it's the word Elite. And then one of our front desk girls will reach out to you in the next day or two to schedule that consult. But if you already have one in August, and it's already scheduled, then you'll be fine. So we'll make sure that I remember that you were at this event. So you'll get the promos and stuff like that. Any side effects? So yes, there are some minor side effects that can happen after CoolSculpting. One being you will have some swelling in that area. Again, it's for the most part pretty minimal unless you were to put a lot of applicators all over the body, which again are like these little things. If I'm putting 15 of these on an abdomen, they're going to be a lot more swollen than if I just put 2 on someone. So swelling's one of the side effects, and then numbness in the area, which again, if I put 15 of those on someone, they're going to be a lot more numb than someone who just had 2. So that swelling, I always say, can last anywhere from a couple days to sometimes a few weeks, even up to 4 weeks, honestly. And then bruising is another one. I do not see a lot of bruising anymore, but every once in a while I do. So again, if you're going to get this done, just make sure you're not going to the beach in a week, or you have a wedding, or, any big event where you don't want anyone knowing.
And I think, that like you want to avoid, aspirin, ibuprofen, Aleve, any kind of anticoagulant kind of medicines beforehand, because people know who bruise easily. If I take an aspirin a day, they get really easy to get bruised. Yeah. So those kind of things avoid too beforehand.
Absolutely.
So I think those are the side effects that you see. But there are some rarer things that can happen. There is a rare, like some people get like a burning sensation later that can be really annoying. And there's some medications that we can give you to kind of help that go away.
Yeah, like some nerve. Yeah. Is that you're talking about the nerve pain? I actually experienced that. With the first generation we had, because like I said, the suction was so intense. That's when we used to and at night is when you feel it because you're not doing anything and you're just laying there.
And so
we
used
little prickles.
Yeah, and so we used to treat. We had it more, but really, I think that has significantally dropped off.
I haven't had anyone
with the newer
come
generations.
Back. No, not at all.
So that can be a side effect. Yeah. And then there's the weird one that I think we want to see, like paradoxical hypertrophy. And paradoxically, what happens to getting smaller, you get bigger. And it is a weird response that some fat cells can have. And I think we've seen it once. We've had some other patients.
Other practices across the U.S. have for sure. When I've gone to the universities, they've talked about it. and you know if you're someone who gets it because you can see exactly where it happened.
Yeah.
But it is, you can take care of it. So
right. And the nice thing is that here we have
you
4 board certified plastic surgeons, so
yeah.
There's no fat that we can't get out with some other.
Yeah.
So we can make it look as good or better.
Yes, absolutely. So you're in good hands for sure. How long do results last? Yeah. So kind of, I think we somewhat went over this earlier, but as long as you maintain your weight and what you're doing when you come in and get your treatment done, the results should last basically forever. Because again, those fat cells are not coming back. So.
Right. And if you don't, you're not gaining it, and you're going to maintain that because, like you said, the fat cells are dead and
yes.
gone. So.
They're out of here. Can it help with the chin and neck?
Yep.
So we do treat the submental area, which can be anywhere from just putting 1, or we can do 3 all across if you're kind of from ear to ear. And so, yeah, we do treat that. We also have other options too, though. So sometimes we also do Kybella. It just depends. But we do this little applicator. So it's this little guy right here that we kind of hook up right there. So, and like I said, we can do up to 3.
Yeah, but like you said, there's other,
that's a tough one because you take a lot of, you look at other aspects of that area too. I look at, do they have platysmal bands? Do they have jowls? Do they have laxity already? Some people have what they call a turkey gobbler. So that one can be, there can be a lot of options basically.
Right. Like we offer them all. So like you can, she talked about, we do Kybella, which is an injectable material, but if it gets too big, it's not, CoolSculpting will work better.
Yeah, it does.
And so then we get to CoolSculpting. If there's more than that, and we want to take down and feather down on the neck or the muscles and that kind of stuff, and we got liposuction, and we all do that. And well, not her, but and then neck lifts, face lifts. If there is something you need as far as that area goes, we offer it here.
All right. Let's see. What happens if you gain weight after the treatments?
You get bigger.
Yeah. I think we've probably gone over all this a little bit. Basically, I think you said earlier, like say you get rid of 50% of the fat cells in that area, it's probably less. Would you say less likely to go back to that exact area, maybe? But it might go else. It'll go elsewhere. Right.
I mean, it'll go everywhere that your body would naturally put fat when you gain 10, 20, 50 pounds, whatever it is. But there will never be as big in that area or that area.
Never be that big again.
Yeah, you'll never be as big in that area as you would have been had you never done CoolSculpting.
And I'll say, I think I've been doing this 8 years now here.
Mm-hmm.
Yeah, a handful. And if I see anything, I feel like this always really jumpstarts people to work out more, eat better, and just be more active and live a healthier lifestyle. So I feel like it's really a good push for people to do that. So hopefully that's not the case, that you don't gain weight after, but it can happen.
And then we do the CoolTone with them now too. So
yeah,
I think, CoolTone is a really nice way of, once you kind of shrink the fat down and then you really want to tone up and look good. CoolTone's awesome.
Yeah.
You feel it. It doesn't hurt.
Yeah, it doesnn't hurt at all. It's just it's an interesting sensation for sure.
It tightens the muscles. You're like, I just did 30,000 sit-ups.
Yeah, yeah.
It's well worth
it. How much is a consultation? So our consultations are free. So
easy.
Not much is free anymore, but that is. No. Do you have any payment plans or take care credit if that is still a thing? So yeah, we do accept care credit. I think we also have patient fi as well. So we have a couple different financing options that we can discuss when you come in for your consultation.
Mm-hmm.
Does a doc come in at my appointment? So yes, one of the great things about coming to Renaissance is that we always will have at least 1, if not 2, of our board certified plastic surgeons at here in the office in general, but also we always will have one of them pop in at our consultation.
You don't have to have 2 of them.
No, not 2. Usually one's plenty. But it's a great tool that we have to offer for you guys, because maybe you're not a candidate for CoolSculpting and you're more of a liposuction candidate or a tummy tuck or whatever it may be. It's great because you can then meet with them, put a face and a name together, and then obviously you would set up a more formal consult when you come in for that. But and then they're able to check too for hernias and just make sure health is good and things like that. So
yeah, it's the greatest thing too, because sometimes patients come in and see me or one of the partners for something else, and I'm like, and she knows I can get her all the time. I'm like, hey,
yeah, I tried today.
Yeah,
I was busy. No.
I said, can you, we've got somebody and she needs her arms done. And I just her face. And,
Yeah. Yeah.
And it's easy when you have just one area, especially. It's quick. It's easy.
Oh, yeah.
It's fun to do.
Definitely. And then again, just a reminder that you will receive a text message after this Q&A. And if you are interested in setting up a consultation with me, just reply with the word elite. And then, like I said, one of the girls at the front will reach out to you in the next day or two to get those set up.
ELITE.
Elite, yes. Does your skin bounce back better with the CoolSculpting versus lipo since it's a slower process? I think that can depend patient to patient based, area based, what was skin quality before we started. I think with some areas, and you can kick me if I'm wrong, but I do think sometimes CoolSculpting can help a little bit more just because it's a slower process.
Yeah.
It takes a full 3 months to see the final change. And so again, I think with arms, it does a really great job.
Yeah.
And I think sometimes that is because we didn't go in there and disturb the tissue all at once. I don't know. It's just, it gradually kind of goes away.
And I think that in some cases, liposuction will actually cause a contraction of the skin by irritating underneath of there.
Right.
But with CoolSculpting, you get a full irritation of that skin as well. And it doesn't freeze the skin or kill the skin, but you will get some stimulation of the fibroblasts in that deep layer of the skin, of the dermis.
Yeah.
And I think that does allow for some contraction. So if people have really loose skin, sometimes I think CoolSculpting may do a little bit better.
Yeah, I definitely think so. And I've really never, with CoolSculpting, I've never had an issue with someone being like, oh my gosh, I have so much skin now. It's like, that's not the case. So just so you guys know that.
Yeah.
I'm 69 and I'm not overweight, but my front and back middle. Okay, so front and back middle are heavy. Can CoolSculpting help decrease that area?
That's what it's for.
Yeah, absolutely. That's exactly what it's for.
The abdomen, the love handles.
Yeah, and it's, it is great for those people who are somewhat within their goal weight, or at least within a range. Because it's, really going to target those stubborn little pockets of fat. So it's not going to be for someone who's wanting to drop 30 pounds. CoolSculpting is not going to get rid of that, but it is going to help with inches and just the way you feel in your clothing and the way your jeans are fitting, where you don't have that muffin top hanging over, things like that. So, but yeah, absolutely, it'll help. So just come in for a consult and we can talk more about that for sure.
Well, and some people who are, let's say you talk about 30 pounds. Let's say you're 30 pounds overweight and you're like, I'm going to stay this way. Doesn't matter.
Yeah, you can still do it.
There's one little spot that drives me crazy. I tell people, once you get to a point where you are content with where you are. I like everything about it. I'm not changing the number.
Yeah.
And but my arms, my sides, my thighs, something bugs you, then it's easier just to address that one spot. It brings everything else into proportion, and then you can, it's just easier. I think you're happy that way.
Yeah. What is an approximate cost of the entire midsection, front and back?
It probably depends on how many applicators.
Yeah, like I said before, we use all these applicators, different sizes, shapes, things like that. I would say it would start around, to be honest, probably $4,200, and that's for 2 sessions. That includes your consult, your treatments, your follow-up, and then again with that you would be getting a free package of CoolTone too, which is a great way to enhance your CoolSculpting results afterwards. So, but again, I can give you an exact price when you come in for sure for your consult.
When do we have them start the CoolTone?
Usually the CoolTone, I've been starting, it depends. So if I do someone's abdomen with CoolSculpting, well, obviously I want to wait until their CoolSculpting's been complete. So at least 3 months, because every little fluff that's above that muscle, I feel like determines the results. But say they want to do their thighs, and we didn't do CoolSculpting to their thighs, but they really want to strengthen and tone those up, or their glutes. Yeah. Then we can do that whenever. I mean, again, we're not CoolSculpting that area, so I'm not worried about that, but just depends.
And CoolTone itself can actually have a decrease in some of the fat too.
Yeah.
But you want to be able to see the muscle underneath. So I think the reason she's not starting too soon is that, The point is being able to see it and feel it.
Right.
Although some patients do this and also say that they feel like they have better balance, a little bit better core strength.
Absolutely.
It can help with that separation of the muscles between, gives you a little bit better tightness, which gives you the core strength that you have a little bit better. So there's a lot of good things, even if you can't see a ripped, six pack on somebody's abs.
Now you won't always see a ripped six pack on someone's abs if we're
but you'll get the effects out of it.
Yeah.
And the CoolTone will actually kill some of those fat cells too. I mean, the studies are good. Not as good as CoolSculpting, but
yeah. But again, just a great little add-on. And I mean, core is everything, I feel like. So if you don't have a strong core, then your workouts are hard. But all right. I think that completes all our questions, you guys. Yeah, we did. So
thanks, Casey.
All right.
And I love your video. It was good. Nice,
Thank
informative.
you. I appreciate it.
Whip that thing out in about 5 minutes.
Yeah. Yeah. Only took a couple minutes. All right. Well, thank you guys for joining in and sending in your questions. And again, with every CoolSculpting package that you purchase, you will receive a free CoolTone package as well. And then we also, again, will be giving away a free Fermentone when you purchase a package too. So be sure to text Elite, and one of the girls up front will get you scheduled for that consultation.
Call, come in.
Yeah.
She says she'll see you at no charge.
Yeah, it's free.
And then
so
she can just tell you exactly what the cost is. And
yeah.
And again, even that
Answer
you kind of
more
get
questions.
in and see what you really want or see what other areas that you need to work on. And happy to help.
Perfect. All right.
Okay.
All right. Bye, guys.
Bye.